Good afternoon. This is Nancy Anderson with SMI. You are all in listen-only mode at the moment, and we will be starting the webinar in just a few minutes. We've got a lot of people signing on, so we want to give as many people a chance to get here at the beginning as possible. So hang tight, and we'll be right with you. This is Nancy Anderson. I'm going to get us started so we can make the most of our hour today. I'm sure that people will be joining the call as we go along, and we will welcome them as they join. But I did want to take a few minutes to welcome you to the Huddle call and just give you some background, some housekeeping tasks before we get into the discussion on the agenda for today. So as always, I want to start by saying thank you to everyone, both suppliers and providers who are on the front lines and working so hard to help the whole healthcare ecosystem deal with this crisis. We are incredibly grateful for your hard work and dedication, and we thank you also for sharing your very valuable time with us today. We understand some of you may need to leave during the call, and others are probably going to join as the call proceeds, and this is really designed that way. We want it to be an open time for discussion, so you are welcome to stay as long as you can, and if you need to leave, we totally understand. We just want to give you an opportunity for SMI members to share their insights, ideas, work together to look for solutions, come up with some ideas that maybe SMI can help implement. And we are recording the calls, so all members will have access to them, and we will be taking and sharing notes from each call. So every week, the day after the call, we will be sending out the notes. The Monday after the call, we'll be sending out the notes along with the invitation for the next week's call. On our Huddle call last week, we talked about working with clinicians to prepare for the downstream product shortages as elective surgeries resume. And based on input from that discussion, our SMI consultants, Dr. Leon Chen and John Lebowitz, are developing a tool to support effective collaboration and drive good questions between providers and suppliers as the current point of the crisis subsides. So we expect to have that tool ready by the end of April, and we'll share it with all of you as we do. Next week's call will feature Joe Walsh, and he will be talking about leading through crisis. We will also have some featured members, and we'll be sending out an invite to that call on Monday. We appreciate your patience. We may be trying out different technologies for these calls over the coming weeks, so just know that we're going to try to find the best way to connect with everyone together and have these discussions. Some housekeeping tasks. We currently have all of you on mute. Once our speakers finish some brief comments, we will open the lines for discussion. But to participate verbally, we need you to raise your hand by clicking on the raise hand icon that you can see here on the screen. It looks like a little hand, and if you click on that, then Christine will call on you and unmute your line so that you can participate in the discussion. You can also type chats or questions into the box, the submit a question or submit a chat box, and Christine will be monitoring all of those as we go along. We have a very big group on the call today, so if we don't get everyone's questions answered, comments included, we will be including those questions and answers to the degree we can put them together when we send out the notes from the call. So if you don't hear your answer in discussion, we will make every effort to get some comments back out to you after the call. And last week, we did have a little bit of technical difficulty, so and to ensure that we don't have difficulty today, I wanted to have a contingency plan in place. If we have any technical difficulties due to these systems being used so much these days, please know that we're going to make every effort to connect with you via email right away to offer a contingency plan. So without any further delay, I'd like to introduce John Lebowitz, who will be moderating our discussion today. John has deep supply chain expertise and is a consultant to SMI's Business Continuity Initiative team. He's been working through this crisis with us to identify resources and create tools for SMI members and the industry. Also joining us today are Jim Francis, Chair, Supply Chain Management at Mayo Clinic, and Amanda Chawla, Vice President of Supply Chain at Stanford Health Care and Lucille Packard Children's Hospital, who will both be sharing stories and experiences that they've had as they navigate this crisis. John, I'll turn it over to you.
Thanks, Nancy. Good afternoon. What a great introduction. I appreciate that. I'm just going to spend just a couple minutes updating everybody on what we're doing on business continuity and resilience. You know, we've started the work on business continuity about a year and a half ago, and we've made some headway in a lot of different areas. But we've also, in respect to everybody's focus and laser focus on what's going on and the short-term urgent needs, we're still doing some work behind the scenes, but also have come into a real support roles. When everybody needs some support, we're trying to marshal resources to help. Just a few things, and again, I'm going to do this really quickly so we can get right over to Amanda and Jim. As you may or may not know, there is a resource center on the SMI website. There's some pretty good resources, as everybody knows. There's an inundation, a confluence of information everywhere. And so what we're trying to do is provide a consolidation point for our members where you'll have some access to either websites or some good information. So please take a look at what's out there on the website. On the SMI message board, so one of the things, and this con calls really starting the process, is I know that everybody's laser focused on short-term PPE needs and other issues, but one of the things that we want to start doing is, as we're starting to think about how we're coming out of this crisis, do some lessons learned. And again, Jim and Amanda have done a great job of framing up our conversation today. But we'd like to start consolidating and get input from our members on lessons that they're learning, and we'll be happy to compile it on a message board, or you can also send it directly to me, John Lebowitz at mainlebo@gmail.com, and I'll do some consolidation and I'll make sure that gets shared. We're also still working on the SMI top 100 items list that we started a little under a year ago. And the intent there was not meant to be COVID-19 focused. It's being able to get a line around a short list of products that every hospital can't live without, and start building some tools and processes around it. And I know there's a lot of other organizations doing something similar. The intent at SMI is we're trying to be neutral in terms of representation. It's a member-supported program, so it's not meant to market or sell. But we still have some work on that we're doing right now. Hopefully over the next 30 days, we're going to be able to roll out our first prototype on some of the framing on it. And if anybody wants any more information on it, just let me know. As mentioned, there's other organizations like GHX has got a great reference list out there, as well as Lemire as well. Our partners, ARM and HUDDLE, have done a great job of marshaling some great resources. So if you haven't availed yourself of their websites and some of the information they have, some really good stuff. There's also another organization, and some people may not have run into, but there's a COVID-19 coalition. And as part of the blog that we sent out, we did send a link to it. It's a really interesting group that's come together very rapidly. And SMI is becoming a collaborative partner with them. But they're able to amass a pretty strong wealth of information and reference information. So I highly recommend taking a look at that. Also, some of y'all are familiar that Stanford's working closely with Resolink on a product exchange. And I think Amanda may touch on that for a second when she's in her presentation. But the intent is, using one of the Resolink's tool, is can we get some very quick visibility on some inventory that's available or inventory that's required for short-term needs, and develop a organized way to be able to exchange information on that. And then Jump Technologies is put out there for free for healthcare networks, the ability to be able to do some inventory tracking. So I know there's a plethora of different resources of people jumping into the game, and it can be very confusing, but we wanted to just highlight a few of the things that we thought might be valuable for our membership. If you have any questions about any of this, please let me know. So without any further conversation on this, I'd like to kick it over to Amanda, who's put together a few slides on some lessons learned that they're kind of working through today, and then we'll follow up with Jim from Mayo afterwards. So Amanda, I'm going to turn it over to you now. Thank you.
Great. Thank you, John. That was quite a comprehensive list. I hope folks took note of that. So thank you, everyone. Good afternoon. Just to provide a brief overview of Stanford for those that may not be familiar, Stanford Medicine represents a multitude of different legal entities, hospitals, clinics, the university, school of medicine, and supply chain is a central shared service across the hospitals and the clinics. We have multiple executive C-level leaders across each one of the hospitals and multiple hospital boards that report to a university board. I'm sharing that especially as we're thinking about COVID-19, how our different entities have come together as one Stanford in working through the COVID-19 epidemic. If we can go into the next slide, what you're going to see is a basic visual of essentially a teeter-totter. And it's fairly straightforward with supply chain really driven by the availability of products and consumptions. And with the present market instability is the words I will use, with the low supply and the high demand, the equation is extremely fluid and constantly changing. And so Stanford began a task force around the fourth week of January when we started becoming more informed about what was happening in Wuhan, and put a number of activities in place around conservation and increasing the funnel, like many organizations. And what I'm going to share with you is kind of the framework around this teeter-totter and bringing some equilibrium around the work that we're doing. So if we can go into the next slide. The way that Stanford has been looking at COVID-19 is around 4 key areas. Really, what's our structure? Are we structured correctly? What is it that we need to do? Analytics and reporting, change management and communications, and then this concept of agility. Starting off with structure, the governing body is probably one of the most important things that has been for us. Having supply chain at the table with infectious disease specialists, with the CEOs, CMOs, CNOs, and a few of the op leaders, having that governing body and that alignment has been essential as the Stanford enterprise works together. There's the traditional command structures, and then there's the PPE task force. The key in these structures that we have found is really that integration within supply chain and that one intra-supply chain voice. We've had to figure out how do we become more efficient. I think this is with everyone working remotes and having team communications and team meetings. I think the other aspect beyond structure and a big component for us has really been around analytics and reporting. This is core as we watch and monitor our inventory, developing a rating scale, both qualitative and quantitative, that shows our entire organization where we stand at any given time is really important. We've developed our own risk rating model on our inventory, looking at burn rates, looking at consumption, as well as what's in the pipeline, as well as qualitative scores of likelihood to obtain inventory, and match that up with patient modeling and projections that we anticipate through our organizations. I'm going to jump over to agility because I think this piece is really important. Diversification of suppliers, that has been a very big thing for Stanford right now, and how we diversify. And we're doing contracts directly with internationally. We actually have sent one of our leaders internationally to do some procurement activities. 3D printing, manufacturing has been significant for us. Partners and relationships, and I think this is kind of where Resolink comes in. Resolink is a company that I was talking to maybe about 3-4 weeks ago regarding kind of local work that happens between hospitals where we may call each other and exchange one product to another. And what would be the value proposition about creating a central forum across the entire nation that would be GPO agnostic, supplier agnostics, in which hospital supply chains could talk to each other, and we could take our local trading and come together as a nation around COVID-19 and give and receive where the needs are. And so that's the work that John was alluding to regarding Resolink. Like many other hospitals, we also are doing a number of other things, donations, reprocessing, 3D printing. The key here for us has been supply chain has to become more agile. The agility and being able to hedge is going to be really important and something that we have been highly focused on. The last category I think is also equally important, and that's really communications and change management. As we all continue to receive new information, new guidelines from CDC or OSHA and other regulatory bodies, sometimes those guidelines change multiple times a day. And that's been a challenge in terms of keeping up with the guidelines. But so the way that we're addressing that is really through town halls, daily debriefs, 1-point lessons, standard work. This diagram is really intended to be, again, a framework model in all the different activities that we're doing, which is likely similar to many organizations. So as I move on to kind of the next slide, some of the key findings and learnings that we've had has really been around, if we could go to the next slide, please, has really been around the gray market. With the amount of brokers that are coming in, we've developed intake processes. Other learnings is, in the media, it's a lot right now on PPE and ventilators, and it's much more broad than that, dealing with direct imports and exports. What we're seeing, and this hasn't yet happened at Stanford, but the seizing at customs of counterfeits and so forth. Communication, I think I can't stress that enough. And I think, again, if anything, the key takeaway here is the nimbleness, the ability to hedge and be agile is essential. And what you'll see here is this is a picture. This is actually a message that we got from one of our donors in the community that wrote, this message for Stanford, and just thought this was really touching. As I'm thinking about, what have been the learnings, what's the future going to be, there's going to have to be conversations around this whole concept of standardization versus diversification, the value propositions, new collaborative solutions. I expect new entrants into the market. I think we're seeing that right now with even our own work. And then lastly, again, this is just a few things, is our allocation methodology has to fundamentally change. It does not represent the needs that we see at the time. So that's it. Hopefully this is helpful for some of you guys, but just a sneak preview of what we're doing at Stanford.
Great. Thanks, Amanda. And as mentioned, like Nancy mentioned, what we're going to do is we're going to get through the speakers and then we'll open it up for questions of that. So I'd suggest start thinking about what some of your questions might be. And when Jim is done, we'll open it up for everybody to have some input. So great work. Thank you, Amanda. Jim Francis from Mayo, are you on, Jim?
I am, John. Good afternoon, everybody. Appreciate the time today. Amanda, thank you for your overview. You did a great job, and I'll try not to be redundant, but we are experiencing obviously some similar things as we try to deal with supply needs across our organization. Much like Stanford, our command center has been up and running for about 10 weeks now. We activated it and called for the Hospital Incident Command Center to be activated to the end of January. We talk a lot about supply chain clinical integration at SMI, and there's probably no better example than what we're dealing with right now of how there is a need there and how closely we are working together to address this situation. Our command center is operational. It's working 7 days a week, pretty much nonstop in terms of inquiries and sourcing and making sure people have adequate supplies. Much like Amanda shared with you, our traditional supply partners or channels that we have used are not sufficient to meet our current demand, so we've had to pursue non-traditional supply channels, something that we're certainly not familiar with and haven't been for quite some time. And I don't want you to get me wrong, but you know, our traditional supply partners are great supply partners, and they're doing everything they can to help us. And everybody I've reached out to has been very helpful and tries to help solve the problems. But the volumes that we're dealing with now, we need to source through different areas. I would say that some days I feel like a drug dealer. I'm making a drug deal every day, and but the drugs are more plentiful than PPE, and maybe cheaper than PPE based on what I'm seeing, and depending upon who you talk to. And I'm really disappointed that I don't know somebody who knows somebody who knows somebody that has a contact in China that can sell PPE, because we're dealing with a lot of that too across our system. You know, I would tell you that probably besides making sure we have adequate personal protective equipment, one of the greatest challenges I think healthcare organizations are having with this crisis is keeping people on the same page with information. And in our case of supply chain, it's keeping people on the same page with the status of our inventory. We get daily multiple requests for status updates. I'm thankful that we have an inventory management system that gives me a snapshot view by site, by product category of everything that we have on hand, and that is updated daily at 6 a.m. So I can see what's on hand across our enterprise, and we can move product around. I'm also thankful that we are an integrated system and have the ability to aggregate our supply inventories and redistribute based on hotspots in our own system. I think most of you know that we're in 5 different states, and some 2,000 miles apart in some cases. So the ability to see if Phoenix, Scottsdale is doubling their cases on an average of about 2 times per every 2 days, doubling about every 2 days, then we know we need to address the Arizona situation quicker with available PPE. Systems that don't have inventory visibility and are not able to track it obviously are in a much more difficult position. So keeping people on the same page from the information standpoint, huge issue in terms of the work that we're doing. I would also say that the data analytics team and supply chain is working overtime. We're having to model burn rates and add in factors like will the burn rate increase based on the number of COVID-19 positive patients we have? How do we expect that growth in patients to impact our burn rate? And then what is the actual practice of using PPE? Plus also activities that are constantly in flux of protecting staff. So moving to some type of universal masking for every staff member changes that model dramatically. So the analytics side of the house is also working very, very hard too. At the same time, we have to protect our supply chain staff, so non-essential staff is working from home. People that are moving product obviously can't go home and work from home. So the primary exceptions are logistics and materials handlers. The command center here in our office is still up and running with people coming into the office and some members of the leadership team. Like Amanda, we've seen a lot of creativity, a lot of people donating, a lot of people sewing masks for availability in certain areas, not in all areas, obviously. We have a local manufacturer that's converted his manufacturing facility into building face shields, which have been critically low, but we're catching up now because they're producing about 8,000 a day for us. We've got parts of the organization making hand sanitizer. We've got people making masks. We've got pharmacy making fitting solution for N95 masks. So there's a variety of innovative things underway that are also helping shore up some supply issues for us. Right now, I'm optimistic that we'll be able to meet the PPE needs of the organization. Of course, it's all highly dependent upon the number of patients we get, the surge, if you will. But I'm confident that with what we have on hand, plus the orders that we've placed through brokers for international product, come through in a timely fashion for us. It's been very challenging sourcing international. Primary reason for that is, we've moved from traditionally placing a purchase order to basically putting cash down or cash up front. And it's an area that, we've got to do our due diligence and make sure that the supplier and the broker we're dealing with is bonded or has all the necessary certifications for the equipment and so forth that we're purchasing, and that we can get it out of China. A lot of things are being redirected to New York City, which is understandable. We're also competing with foreign governments, Italy, UK, others that are producing massive orders for PPE from the same potential manufacturers in China as we work through this. So I'm just going to close by just simply saying that I can't think of a more important time in our industry where education and collaboration and networking with one another and will be critical to working through this together. I can't think of a more important time for SMI as an organization where we're going to learn many lessons from this pandemic, and we'll be able to discuss and address things that we think need to change in our industry, and how we'll transform to kind of meet some of those needed changes. So I'll stop there and see what kind of questions the group has for Amanda. Not me, just Amanda. So.
Thank you, Jim. What a great presentation. Thanks for being so candid, and we fully understand everything that you and your organization have been going through. So again, thank you and Amanda for taking time out for this. So we're going to open it up now for questions.
Yep.
Yes,
and
Jim, if we would just remind everyone. Okay, sorry. Go ahead, Christine.
Sorry, I was just going to say, as I unmute everybody's line, we do have one question that was submitted. Jim or Amanda, do you have any plans to either invest in or identify a local N95 manufacturer? That's the first question.
Jim, do you want to? Okay. Now that I have all the questions, thank you. Not at this time. I know that there are a number of my colleagues or other organizations that are looking at that. Right now, we're focused on reprocessing of N95s.
I would say ditto for Mayo Clinic. If we can find somebody that has N95s in the continental U.S., we would love that and acquire them directly. I think, just in terms of products in general, I think we're going to have to talk about where products are manufactured going forward at some place, or what kind of resiliency do we need to put into our supply chain to have more readily available supply for future issues that might come up.
Great, thanks, Jim. Thanks, Amanda. So we're going to open up now for questions.
Yes, and just a reminder to everyone, if you are on a phone line, you'll need to put in your PIN before your line can be unmuted. But John, Lara Latham has a question. Let me just unmute her line.
Hey, Laura. Laura, are you there?
There you go.
Okay, perfect, good. First, I just would like to express my gratitude not only for Jim and Amanda, but all the other providers on the phone for what your organizations are doing to care for our communities right now. And they're just words don't do it, but it's all we have. So I think my question is, and maybe one is just a comment, but it's another question. It's, Jim, your comment said you wish you knew somebody who knew somebody who knew somebody. And I might say you do know somebody. Suppliers are experienced in sourcing various channels and certainly have experience sourcing internationally. In hindsight, and maybe it's not so hindsight because we're still walking through this issue. Is there a way that you could have used suppliers differently, or is there a way that our supply community could lean in differently than we have?
Yeah, I think there is. Your point's well taken, and that's a little tongue-in-cheek only because, a lot of people are trying to make a buck off of this too. But I think there is, and that's part of that education going forward, is understanding exactly what your capability is as a supplier or anybody else's that has access to these products. The bigger challenge is not so much finding a manufacturer that is either in this business or somebody that can help with international sourcing. It's getting the product out of China. It's basically, I don't know what Amanda has experienced, but if you're not the high bidder on some of this, or if you're not buying in lots of, 2 million products, you may or may not get any type of allocation out of there. And then also the air freight, getting the transportation and logistics scheduled is very challenging. And it probably would only help us if you have visibility or somebody on the ground over in China, which I'm sure many of you do.
This is Amanda. I was just going to add to Jim, I think the knowing somebody that knows somebody for us is probably overflooding my inbox more than anything else. One thing that might help is, to Jim's point, understanding what all the capabilities are. And I don't think today our supply chain has that level of intellect that's easily accessible. A lot of it is individual knowledge, individually known. We don't necessarily have a system or an infrastructure that we can access to say, okay, we've got this shortage or we've got this need, what other suppliers can jump in and provide. So that is a challenge, as well as to Jim's point about getting products internationally. I sent a staff member from our sourcing team to a country to do local manufacturing and to do international sourcing some time ago, and it's definitely a challenge. And it is a new business for us to even be doing imports and exports and things of that sort.
Thank you both. We're suffering the same. I got a guy. I got a buddy. Everybody's got a buddy right now, so we're feeling that same experience. I guess I just would offer, and I won't speak for the other suppliers, though I know my colleagues would lean in on this as well, as this maybe is an area where we can get better, and we can learn. Many of us that support procedures are actually trying to source PPE for our own people as well. And our sources are those overseas. So there's probably an alignment opportunity here as we think about some lessons learned for the industry as a whole. And John, that may have a place in your business continuity work group.
Totally agree.
The one thing sorry, go ahead, John.
No, go ahead.
No, I was just going to say, the one thing that we have done at Stanford, if you are doing PPE and or other critical, is we have developed an online form and an intake form that is helping our team prioritize their time in the sourcing activities as we continue to get approached. And so we'd be happy to get access to that form and that process.
John, we have a question from Brian Washa from North Shore. Go ahead, Brian.
Oh, I'm sorry. This is Brian Murray from North Shore. I must have stole my boss's login on the go-to. Sorry about that. But you know, can you guys talk a little bit about the due diligence of vetting the third-party sourcing from China or overseas? You know, we've been dabbling in it and trying to make sense of how to use a freight forwarder and how do you validate that what's going to come in is legitimately what you're ordering. It seems so gray and so far from our normal. Definitely, we do not feel like an expert at it yet. We've tried a few different options. Nothing has come in yet, but expect it soon. It just, if there's any guidance you two can provide, that would be incredibly helpful.
Well, from my perspective, I don't think there's an exact science, Brian. It is gray, and a lot of it, I hate to say it, a lot of it is by the gut decision making, because especially when they're asking for 50% or 100% upfront. You know, what we've been doing is making sure the brokers are legitimate businesses. Ideally, if they're already authorized distributors for a company like 3M, that's a major plus. Do they have the exact product we're looking for? So versus a knockoff, and there are a lot of knockoffs. So we're looking at all their product information and all their certifications. The basic rule of thumb that we've been using is, are they NIOSH certified? We have obviously, probably like you and others, the preference for the 3M N95. I think they're 8620 is the number on them. The other thing I would say is, you know, if they have a requirement for an escrow, that's better. We're recognizing immediately that if you want to get product, you're going to have to put some money up, because I think the Chinese manufacturers are basically ignoring other PO type requests and so forth. So those are kind of some of the bigger things that we've been looking at to make decisions with, but it's been fast and furious, and this is no joke. I think we've been on the phone with 10 different intermediaries today, and quite frankly, you get confused after a while because there's so much information floating around, and everybody's got a better deal. And then we look obviously for them to confirm the order and put tracking numbers in place so we can see where the product's coming to, and if we can get the product as closely as we can to our entity here in Rochester, Minnesota, that's our preference.
So this is Amanda, Jim. The one thing that, you know, sorry, go ahead.
No, go ahead.
Okay. Yeah, no, the one thing that I was going to say, so because we've been having the same struggles and challenges, is on our intake form, you know, the way that we're prioritizing these brokers is we're asking for their DUNS number or their cage number, and the FDA number, the establishment number, references, and because we're getting so much intake as part of our screening process. And once we've done our screening process, you know, then we're going through an internal process, and we've had to do wires, we've had to do the escrows and all sorts of, use the emergency credit cards and so forth, which has helped with being able to get our inventory. And then we've actually also signed on some consultants for custom brokers, so that way we can ensure that, you know, what we're paying for is going to come through and is going to reach Stanford, whether it's through our procurement channels of what we're purchasing or whether it's through our donors. So that's part of the connection. We actually have someone dedicated on our team who's now just really dealing with customs and shipments and things of that sort, which is a new business for us, and definitely a gray area that we continue to navigate in.
Any other questions?
We have another. Yep,
Okay.
we do. We have a couple questions that were submitted via the questions feature. So for companies that provide critical products or service equipment, excluding PPE, how can we better meet your critical needs, prioritization or communication?
So this is Amanda. I'll just start off with, again, it's our,
Yeah.
Go ahead, Jim, if you want to take this one.
No, actually, I got a call, so I missed the question. So go ahead, Amanda.
Yeah, so I would say, you know, for critical equipment and things outside of PPE, it's the same process, at least for Stanford, with suppliers and having that intake form. And then internally amongst our team, we've got our staff divided up with folks that are focusing on PPE, lab supplies, all other procurement, capital, ventilators, all of that. But really the best way to reach Stanford is through the intake form and central process that we have, because I'm probably getting upwards of 1,000 emails a day and several hundred that are just referrals for things of that sort. So the having the intake process is really will help us streamline and also get to you as well as viable suppliers.
And Christine, can you just rephrase the question for me? I heard what Amanda said, so. If you're talking, you're on mute.
Oops, I'm sorry, Jim. Yep, nope, the question actually is, once someone answers it, it's gone, but we have another question submitted in the questions feature. Do either of you see this as accelerating hospital consolidation, as the costs associated with COVID-19 may cause more distress on hospitals' P&L?
Well, from my perspective, I don't know if it will result in consolidation, but there's no question the financial performance of every healthcare provider is going to be dramatically impacted. Certainly in fiscal year 2020. And I guess I would go as far as saying that it will be interesting to see whether some institutions can survive, depending upon their ability to manage their expenses going forward and work off of reserves that they have while they rebuild their business. It's going to be an interesting year and a difficult year.
Yeah, I agree with you, Jim. I think, you know, to add to it, it's the expenses and it's the revenue side for the organizations that are seeing the COVID positives and the high amount of PUIs. You know, censuses have dropped significantly, as well as certain counties and states mandating no elective surgeries. And so we're definitely experiencing that drop in volume, both on the surgical and the inpatient side, quite dramatically. And at this point, you know, the expenses are going to continue because you need to respond to the immediate needs. So there will be a domino, some sort of impact, you know, on the financials. But is it going to result to more consolidations? I don't really necessarily know that or think that we have enough information. I think it truly depends on how the pandemic progresses. You know, New York is seeing it quite significantly, and if that type of those type of numbers go further out throughout the country, then it could have a substantial impact.
John, Kevin McMillan from Steris has his hand raised. Kevin, do you have a question?
Yes, I do. So, Jim and Amanda,
Yes.
first of all, thanks for your insights today. It's very much appreciated. So what we're anticipating is the level of pent-up demand for elective surgeries is going to be significant. Patients are going to want surgeries completed, and certainly the surgeons are going to want to get back to work. Most likely scheduling elective surgeries 7 days a week, and certainly extended hours per day. So this is going to bring extra strain on the staff that are already dealing with the worst pandemic we've seen. equipment and instrument sets for surgery are going to need to be in really good condition to enable the workload that you're going to be facing. And many times these surgical devices and instrument sets are not serviced due to the demand for really busy specialties such as ortho, neuro, and so on. My question is, what contingency plans should be in place to address preventative maintenance and repairs during the shutdown of elective surgeries, so when those elective surgeries are resumed, you will be better prepared to handle them?
A great question, Kevin. What I can tell you from a Mayo standpoint is that assessment is underway right now. Mayo is anticipating starting back some urgent, emergent surgeries starting this next week. Probably primarily patients that have life-saving surgeries needed, like cancer patients and so forth. I do know patients are coming in for a few days in advance. They're being tested in quarantine before the actual surgery happens. So it's going to be a slow ramp up. I'm hopeful that we can get back to normal operating activity as quickly as possible, but there's a great deal of uncertainty as to how long this is going to last right now in terms of current modeling. No doubt there'll be stress on the system, and people will be expected to work longer hours. I think institutions are considering a variety of things to address that. I'm uncertain until the assessment's done as to whether or not the need's going to translate into incremental staffing and incremental supplies to accommodate.
Jim, I think you summed up the question quite well, or the answer. And I would say for Stanford, we're in a similar position where we've started to think about that. We've started some framework around, okay, this is what our volume has been. This is what the pent-up demand is. What do we anticipate that will do to blocks and after hours? And do we have the resources, again, from a staffing as well as an equipment and supply perspective to meet the pent-up demand? But again, we're very early in that modeling, but that's definitely a real concern or a real question out there.
Well, thank you, Jim and Amanda, for your comments.
Yeah, and I would add that to the best of my knowledge, there's not been any discussions about when elective surgeries would be resumed at this point.
Thank you.
Great. David Stone from Coloplast, do you have a question?
Yeah, this is Joe Muir from Coloplast. Actually, I just have a comment. So having spent time working internationally for large medical device companies, from a vetting process, what could be helpful is to work with your large medical device companies that actually have organizations and feet on the ground, whether it be in China or other countries, that could potentially help you screen folks that you're talking to. So I would reach out to those individuals that you partner with on the large med surge side, med device side, and they may be able to help you with their international teams that already know some of these folks. So I just wanted to provide that as an idea or thought.
Yeah, I agree. It's a great thought.
Yeah.
I would also say that I don't want you to have the impression we're not. We are working with some companies to look at, what capabilities they have. Of course, they're very busy trying to help everybody else at the same time. But I don't know what Amanda's life is like, but if it's anything like mine, every day is a firefight. In terms of trying to put out a fire someplace, and they're just constant. You know, I had a doctor screaming the other day because they wanted a second-by-second update of available inventory on hand. And took a while to calm him down because I'm not sure much changes on a second-by-second basis. But, you know, those are the kinds of things that we're dealing with.
Okay, well, good luck.
Yeah, Jim, I'd say we're in the same position, and you know, our life is maybe 3 or 4 hours of sleep a night, and it's morning till night, and it is a bit of a whack-a-mole. And I think that's why the structure and having the process and the agility, even though we have frameworks, it's a significant amount of demand of our time as well as our team's time. And sometimes we are moving at such a rapid pace, it's hard to slow down, and because the demand is so high and things are moving as quickly as they are. But as Jim stated, we're also working with someone who has experience and boots on the ground and doing some of that vetting, which is helping. But again, there's only so much that can occur through that route.
I'm sure. Okay. Just wanted to pass it on.
Yeah, no, thank you.
It's a great idea.
Yeah.
Thank you.
I think what we're trying to communicate is that we're both so busy operationally that it's very hard to think about strategic sourcing.
Yeah.
I'm sure. I'm sure.
Jim and Amanda and John, Leon Chen has a question. Go ahead, Leon.
Yeah, hi, thanks so much. Thanks, Amanda and Jim, for sparing time and helping everybody else around the country. My question for you is, you've obviously got a ton of data coming in to help you with your demand planning, right? And so I'm wondering what you're doing other than looking at data. Specifically, how are you engaging your clinical leadership? What information have they been able to give you that's useful to what you're doing?
So for Stanford, our data and analytics have evolved quite a bit. When we started back at the beginning of February, we started a clinical task force really around PPE conservation and only had a number of SKUs. And what we did is we developed actually a rating scale. So it wasn't so much about this is how much inventory we had. We have that rated based on on our inventory on hand, a 1 through 9 scale. And then we had qualitative metrics around here's our rating scale for the sourcing activities behind this, and partnered with our clinical teams in transparency and say, this is what we actually physically have. This is what the market looks like. This is what our pipeline looks like. This is what our burn rate is. How can we conserve together? Because we do need to conserve. And those activities, when we started at the beginning of February or so, have been tremendously helpful. I think we would be in a far off position had we not started the PPE conservation work. That model and that work evolved similar to what Jim spoke about through the command center. And what we actually have is we've created a governing body, which is really made up of primarily the CEOs and infectious disease folks and some of our chairs, primarily the C-suite across the multiple different legal entities. And that's where a lot of that decision making occurs. But one of the avenues that reports directly into that group, and I sit on that group, but one of the areas that reports into it is a PPE task force. And we've got a clinical and supply chain led task force that drives infection control, that determines the guidelines and drives the communication and the decision making, and then the logistics teams that report into it. So both the data and the clinical engagement is a joint conversation. The data helps inform things directionally, and then the clinical input is really driving the way in which we're utilizing it. And then again, just daily reporting and trending of where our inventory is, as well as what the hotspots are, so we can see ourselves more clearly as an enterprise.
Great, thank you so much for sharing that.
I think what I would add to that, outside of supply chain management inventory activities, you know, we have a daily leadership dashboard on the number of tests that have been completed on patients that have been, or any citizen, I guess, that is presented with symptoms, the number of positive tests, how it's grown day to day, the number of employees we tested, how many employees are positive, the number of patients that are admitted, the number that have been confirmed as positive. Unfortunately, fatalities is on the list too. The other aspect of the data that we're getting out of the clinical administrative side of the house with the School of Medicine and these biostatisticians and scientists is the modeling of based on the number of patients and the doubling rate that we're seeing between our three major geographic areas, Arizona, Florida, and Rochester, Minnesota. So we're seeing all that modeling that's being done that's updated daily too. And as I mentioned very early on, some of that data is inputted into our modeling where we add it to our existing burn rate and determine how quickly we'll run out of supplies or a particular PPE item.
Thanks very much.
Very sobering information.
Thanks, Leon.
Christine.
Yep. Do you have another question, Leon?
No, I don't. Thank
All
you.
set?
Oh, I just
Okay.
dropped my hand raised.
That's okay. And Jim and Amanda, there's a question in regards to ordering and procuring supplies. Is the UDI beneficial to identify counterfeit devices?
Well, we like to validate that before we get any products and look at the UDI specifically. We've relied a great deal on 3M being, an original equipment manufacturer to certify and determine in advance whether N95 masks are equivalent to the 3M brand.
I think in addition to that, we're actually looking at the specifications of the filtration rate, the fluid resistancy, and getting to that finite level. And I think our team has probably become experts in the different levels that are required as well as the process. And so it's a combination of both. And we try to do that with the purchases that we are making as part of our validation process.
Thank you. Kevin McMillan, do you have another question?
No, I do not. Thank you.
Okay. Okay. So Nancy and John, we don't have any other questions at the moment right now.
Well, the timing is right, if I may. This is Nancy. We're just coming up on the top of the hour, the 4 o'clock hour. We can certainly stay on and have anyone who wants to continue the discussion do so. But at this point, I think we need to let Amanda and Jim head back to their facilities and get back to work. And Amanda and Jim, we certainly appreciate your taking this much time out of your day to share your thoughts with this group. I know everyone really appreciates hearing what you have to share and getting a little bit more insight into what's really happening in hospitals these days. And John, thank you very much for your contribution, your expertise, and for all the work you're doing to help SMI help our members through this crisis as well. As I mentioned, if any of you would like to stay on and continue this conversation, the SMI team can certainly stay on. If you want to stay on after 4 o'clock, would you please raise your hand so that we know that we know who's going to be part of that discussion. And otherwise, again, thank you very much for this call. We appreciate everyone making time to get together and talk and find ways to collaborate. We will be producing notes and have the video out for this call, along with the invitation for next week's call featuring Joe Walsh. Will be coming out on Monday, so watch for that and register in your email. And we wish you all good health and that you stay safe, and we'll look forward to talking again next week. Again, the SMI team will stay on for anyone who wants to continue the conversation. Christine,
so
do you
much.
have hands
Thank you
raised?
very much.
Thanks, Jim. Thanks, Amanda. Great job.
Christine, do we have any hands raised of people who would like to stay on after the 4 o'clock hour? You may be muted.
Yep, Nancy. So we have just one hand raised.
Okay. I think given the fact that we have only one hand raised, it'll be a little hard to have a discussion. So I'm going to end the call at this point. Again, thanks to everyone for participating in the call. We really appreciate it. You'll be seeing the notes and the invitation for next week's call. And if you have any thoughts for future topics on huddle calls, please let us know. We welcome your feedback. We welcome your input. We want these calls to be as productive for our members as possible. Again, we wish you good health, stay safe, and we will talk to you again soon. Thank you.
Bye-bye.